So if you look at like applications or like people thinking about applying AI in medicine, I mean that's been like a long-standing grand challenge for the field, and people have been thinking about doing this ever since the beginning of AI in some ways. And I think for maybe like the first 4 or 5 decades, that the challenge is more in the technology. But then maybe in the last 5 to 8 years, I think the challenge has been more in the translation and implementation. And where maybe things do slow down a little bit is, everything in healthcare, it moves at the speed of trust. So you can have like great research papers and models that will work well in the controlled settings in the lab. But ultimately, like the people using them, whether that's the clinicians, doctors, or the nurses involved in the care workflows, or whether that's like the patients or the people or like the care providers themselves, like they need to be able to trust the system and be able to understand the system and feel like it's actually helping them. And so that like building trust is not going to happen overnight, but rather it is a gradual process. So it's more of an evolution rather than a revolution. But what we are seeing is like people's behavior and people's understanding of AI is improving. People are less scared. They're having more and more of these magical experiences in, say, less personal domains. But still, like people are starting to see that yes, this thing is like actually starting to work. It feels like magic in some places, and so the trust in AI in general is improving and building. And that means people are now more willing to allow like AI to be part of their care journeys as well. But you can't force it on people. That has to be like a gradual behavior change that happens. But yeah, I think we're getting to the stage now. I think we're getting to the stage where, for example, people are regularly going to like ChatGPT or Gemini and asking for more information about their medical concerns and asking for medical advice and getting that explained to them. And so we're definitely seeing like in this new era of like searching and searching with large language models, the percentage of queries that put into like health and medical advice, that has gone up compared to like using traditional search engines. And so it feels like people are more willing to share information because they feel like these models are much more helpful to them and can maybe understand them better. So that's the first part. And then the second part is more about like, okay, like with data backing us up, we need to be able to show that these systems are actually helpful when you deploy them. And so that means doing like prospective studies and controlled trials, and having the data to back up saying that, okay, yeah, these things are really helping doctors in terms of like being able to provide better care, like patients are liking them, and overall it's improving like outcomes for everyone. And again, that's not easy. These studies, doing that rigorously takes a lot of time, and they require like sometimes years of investment. But that's the kind of approach that we need. So again, like there's no shortcuts in healthcare. Everything moves at the speed of trust. But if we are patient and if we do things the right way, then I can totally see like in 5 years, like a lot of people benefiting from AI, and that includes cancer care.